Attendees are in listen-only mode.
Hi, everybody. Good afternoon. For those on the West Coast time, good morning to you. My name is Aida, and I'm the project director of the GAVA evaluation study. I'm joined by two colleagues today to share the results of the first 5 years of the initiative that has been going on in two specific zip codes in Austin, Texas. GAVA, which stands for Go Austin, Vamos Austin, is an ongoing initiative. And if you'd like more information about the coalition and the intervention, there will be a slide with contact information at the end of the presentation. We are very happy you have joined us today and welcome all the questions. Please feel free to type them in the box as we go along, and we promise to answer them all at the end. Quickly about the evaluation team. We are from the Michael and Susan Dell Center for Healthy Living, which is housed at the University of Texas Health Science Center School of Public Health in Austin. There are many projects happening at the center, but the mission of them all is to advance health and healthy living for children and families through cutting-edge research, innovative community-based programs, and dissemination of evidence-based practices. And of course, one way to disseminate information is through things such as this webinar. Today, we will cover what exactly is GAVA and a little bit about the initiative, how the evaluation of the initiative has and is taking place, and we'll conclude with some PARC results. The first presenter will be Nika Akavan, who will speak about the GAVA intervention and strategies and what's going on the ground, followed by, you'll hear back from me, who will provide some detail about various sub-studies. And then you'll hear from Christine Jovanovic regarding PARCs.
Hello, everyone. So first off, I'm sure you all are wondering what exactly is GAVA. So in 2012, the Michael and Susan Dell Foundation partnered with residents, schools, and other community organizations to launch Go Austin, Vamos Austin, GAVA, a place-based cross-sector initiative to improve the health of children through improved access to healthy food and safe physical activity. Implementation of GAVA efforts began in the zip code of 78744 Dove Springs and expanded to the neighboring zip code of 78745 2 years later. As we know, social and physical environment are important determinants of public health outcomes such as obesity. Where or the condition of a place in which a person lives, works, and plays affects a range of health conditions. People living in socially disadvantaged locations have consistently poorer health and well-being. As the figure shows, social and physical environment account for about 60% of population health predictors. GAVA is a place-based intervention addressing the contextual factors that contribute to health problems and health inequities. GAVA is unique in that it places residents and the directly impacted at the forefront of the work and uses community organizing to drive systems change. GAVA's theory of change rests on two pillars. First, access to built environment elements such as parks and healthy food influences healthy behavior changes, especially when coupled with demand-building strategies. And secondly, facilitating residents' capacity to lead these efforts increases relevancy, community ownership, and community use of such infrastructure. As previously noted, the GAVA intervention is currently isolated to the 78744 and 78745 zip codes highlighted here. These zip codes lay east and west of Interstate 35 in the southernmost portion of Austin's Eastern Crescent. To identify potential sites for GAVA partnership, the foundation sought to determine both the needs as well as the capacity within the neighborhood that would create conditions for success. Need was defined as a combination of socioeconomic characteristics of residents, lack of environmental assets promoting healthy eating and physical activity, and childhood obesity prevalence rates. Capacity and potential included the degree to which residents and organizations were active and primed to take ownership of such an initiative in their neighborhood. Given the place-based approach, it made sense to curate these numbers with a geographic focus. To that end, the Dell Foundation partnered with Children's Optimal Health to produce GIS maps of zip code level demographics and of community infrastructure for food access, physical activity, and transportation. These were supplemented with fitnessgram data collected in schools to identify obesity hotspots across the city. Together, these data presented a comprehensive picture of which zip codes had the highest need and lacked the infrastructure and access points to address it. Displayed in the graphic here, you can note Dove Springs as having a significantly higher concentration of overweight and obese Austin ISD middle school students, providing a major indicator that there is high need in this community for a health intervention. Here's another map illustrating the needs in Dove Springs based on the health and food landscape of the community. There are a few clear observations that determine Dove Springs to be a hot intervention spot, including that there are very few food outlets located close to where families live. There are few food establishments in Dove Springs that supply both fresh meat and fresh fruits and vegetables. However, you do see a large amount of green space in this area, not all of which may be accessible for recreational use and appropriate for children to play in, though. In this graphic here, you can note some of the key community profile indicators the Dell Foundation used in their assessment. In terms of capacity, it was clear that Dove Springs stood out in terms of high leadership and community engagement, which are utilized at the forefront of the GAVA model. Their analysis also revealed that there were both significant need and capacity in the neighboring communities of 78745. If you take a look at the map here, you can see west of I-35 a major obesity hotspot in this zip code as well. Choosing two especially geographically contiguous communities across Austin's I-35 corridor created the opportunity for the place-based efforts and messaging to reinforce each other. Also, having two communities with very similar demographic populations were important for comparing trends and successes. So now that we're familiar with the history of building the intervention, in the next few slides I will discuss the organizational structure of GAVA and what types of work residents are working on in their communities. GAVA is a coalition-based initiative with its headquarters currently fiscally housed at Marathon Kids, Inc., and 7 partnering organizations that were hand-selected for their knowledge expertise in 4 core sectors, which are food, physical activity, school and out-of-school time, and early childhood. Because GAVA is not yet an independent 501c3 organization, there is no board of directors. However, there is an advisory council made up of a simple majority of residents and community stakeholders from teams on the ground, as well as leadership from partner organizations and institutions, which gives strategic guidance and feedback to the executive director, Carmen. The director functions as the key strategist to lead the work within the neighborhoods, as she has an organizing background, a strong history with the residents, the community challenges and opportunities, and collaborates with the teams of operational staff across the partner agencies. The GAVA Coalition is currently comprised of 7 key partner organizations, networks with over 122 more, and has engaged with over 1,700 residents in the past 5 years. Staff organizers form relationships and engage with residents and community stakeholders by holding hundreds of conversations through organized block walks, one-on-one conversations, and neighborhood meetings. They gather contact information and identify specific interest areas the residents would like to get involved with in his or her neighborhood. And based on this data, staff can best connect the resident to other community members interested in similar projects, and they may form a team based on these common interests. The GAVA Coalition works on 4 core sectors, as mentioned previously, focusing on community organizing and leadership development in each one. Community safety is also addressed in all 4 sectors with efforts to improve pedestrian safety, increase active transportation, and reduce crime around each site. When 78745 became active, a new model of team organizing formed in micro-neighborhood or geographic, or for short, GEO teams, organized around specific areas within the zip code to address all relevant access points for that area. Strong teams began to develop within local housing complexes, mobile home parks, and neighborhood associations, and implemented multi-sector strategies. Just to share a tidbit about the type of work you see within the 4 sectors, here's a short capture of their work. Within the physical activity sector, you see efforts revolving around improving parks and creeks through community stewardship and Austin Parks Foundation Adopt a Park program, advocates for equitable funding and investment in park infrastructure and amenities, and activating green spaces through community events, sports, and beautification days. In the picture captured here, you'll see the Odom Elementary Adopt a Park team at their very first It's My Park Day, an annual initiative hosted by the Parks Foundation where thousands of park adopters and volunteers work to improve parks and greenbelts throughout the city. This is the first time Austin Parks Foundation provided Adopt a Park team trainings and materials in Spanish and hosted the first Spanish-speaking teams. The food sector, on the other hand, has partnered with the Sustainable Food Center and increased access to farm-grown vegetables and fruits through neighborhood farm stands at schools and apartments. Also, these teams are engaging in GAVA's Healthy Corner Store initiative to bring healthier options within walking distance. In the photo captured here, you'll see a resident of the GEO team, Lavaz, helping run the farm stand at the Sierra Ridge Apartments of Foundation Communities. The school sector is working with schools to create and/or support their coordinated school health teams, which engage with school staff, which includes principals, assistant principals, PE teachers, classroom teachers, nurses, cafeteria managers, parents, parent support specialists, and students to create a healthier school day. In the example here, you'll see Mendez Middle School's coordinated school health team approached the principal to advocate for open gym with reasons why students would benefit from moving their bodies before the school day begins, like that it helps calm them down and improves their learning. Once the principal saw the team's research and plan, he let the team establish the school's first open gym. Here you'll see the kids are playing before the school day begins. And then finally, there's the early childhood sector who works with early child care providers and parents to increase access to physical activity and healthy food for children under 5. These settings include home-based child care centers, nonprofits, and preschool programs at the nearby schools. One GAVA leader and early childhood provider cultivated an active room for crawling infants using mini-grant funding, while others focused on a child care garden to expose children to fresh produce while teaching them how food is grown and how it tastes. GAVA is an exciting phase of forging independence as an organization while also forming a solid partnership and affiliation with the Center for Place-Based Initiatives at the Department of Population Health of the University of Texas Dell Medical School. To learn more, get involved, or support GAVA's work, visit goaustinvamosaustin.org or call the numbers listed here. And now back to Aida.
Thank you, Nika. So as Nika mentioned, this is a multi-component obesity intervention designed to target multiple sectors with an emphasis on environmental aspects of the community. You probably have noticed by now this is very complex, and so the complexity of intervening on both food and physical environments while taking sustainability of changes into consideration calls for an evaluation. And so truly, the goal of any program evaluation is to provide insight into program effectiveness and possible improvements, because how do you know something is working if you do not evaluate? We at UT Health were commissioned with the task of evaluating outcomes resulting from GAVA intervention. Our purpose really is twofold. First, we want to assess the impact GAVA is having on residents' awareness of resources in the community, any barriers to using community resources, utilization of these resources, and obesity-related behaviors and weight status of residents. And also we want to deliver continuous feedback to the implementation team. Our hypothesis is that residents in the intervention group, compared to those in the control, will be more aware, perceive fewer barriers, and will make greater use of the physical activity and healthy eating resources in their community. Furthermore, residents in the intervention group will be more physically active, engage in more healthy food behaviors, and have healthier BMI scores. So to do that hypothesis, to test it, we are gathering data from quite a few sources. We do have somewhat of a complex evaluation plan, which includes 5 different sub-studies. Our sub-studies are a 5-year longitudinal cohort study, yearly serial cross-sectional survey with randomly selected community members, yearly community readiness assessment, a pre and post objectives assessment of community resources, those being parks, recreation center, trails, corner stores, community gardens, and school gardens. And we also conduct yearly interviews with elementary school principals. All recruitment and data collection, I must say, and our procedures and protocols were approved by the University of Texas Health Science Center Institutional Review Board. And all of these studies I'm about to discuss now, I do want to say that we use different recruitment strategies and study designs. First of our sub-studies is the cohort studies. In the very first year, we recruited 316 parent-child dyads through 10 elementary schools, 5 of which were the intervention schools in Dove Springs and 5 were control in a neighborhood similar in demographics to Dove Springs. All children were kindergartners at the time of the intervention. And each year, at the start of the school year, the evaluation team takes height and weight measurements of both the child and the parent takes a survey. The cohort survey is rather lengthy. It's about 115 questions, and it takes about 30 to 45 minutes, depending on individuals' literacy level. However, the parents are compensated monetarily each year for doing these height weight survey measures. The survey looks at a few different outcome variables. We look at awareness of available and safe, affordable physical activity resources, any barriers to using PA resources, utilization of them, of course, the sedentary behaviors, the healthy eating behaviors, healthy food available at home, and body mass index, which we gather through the weight measurements. Year 5 just concluded, and I must say that we did quite well. The first year, 5 years ago, the 316 parent-childs that we recruited, we were able to measure 270 of them. So that is a very, very good outcome, especially with the population that moves quite a bit and who is rather hard to get a hold of. The second of our sub-studies was a cross-sectional study looking at community members' behavior, perceptions of, and access to healthy foods and opportunities for physical activity. This was done yearly in Dove Springs by hitting the pavement, if you will, and knocking on people's doors. Each year, about 150 surveys were collected from Dove Springs residents. I say around 150 because we collected 30 surveys around each asset, and in year 1, those assets were 5 intervention schools. The intervention schools served as the loci for the door-to-door surveying during all the years, and as the assets in the community grew, thanks to the GAVA coalition, so did the number of districts we would survey. This year, in spring 2017, for example, there were 9 districts, and so we collected 178 surveys. So to collect close to 200 surveys actually took quite a bit perseverance from the team. In total, we had to knock on almost 900 doors. Most of the people we knocked on, their doors were just not at home. About 200 declined. Few homes we did not approach because the person either had a no solicitation sign or no trespassing sign, or there for other various reasons, such as maybe loose dogs. And some people very few were not eligible due to the fact that they may have not either spoken Spanish or English, or they were part of our cohort study. The surveys that the door-to-door participants took were not as laborious as the cohort survey, as this one only had 62 questions and it took about 20 minutes. All participants were given a cookbook as an incentive. Again, we created a very specific protocol regarding which streets and homes to survey, and please, if you would like to know what that protocol is, you can send me an email or kind of ask a question at the end of this webinar. I will say that we did alter going into the field. The very first year we went in the summertime, and we learned very quickly that that is not the smartest thing to do in Texas, where it's 100 and kajillion degrees. So we moved that up to the springtime, and I think everybody on the evaluation teams appreciates going just a couple months earlier, door to door. The next sub-study was also a cross-sectional and involved qualitative data. We wanted to see how prepared and willing the community was to take action on a certain issue by conducting community readiness interviews. And again, those issues are what we're looking at is is physical activity opportunities and healthy eating opportunities. The questions and the scoring were modeled after Community Readiness for Community Change Handbook, developed by the Colorado State University's Tri-Ethnic Center for Prevention Research, and you will find a link to the handbook, and it's quite useful because it does talk about how you should choose the people to interview, how the scoring goes, and it gives a nice little scoring overview. The questions were semi-structured and got at 5 different dimensions, measuring community knowledge of efforts, leadership, community climate, knowledge of issue, and resources related to that issue. We interviewed about 24 stakeholders a year, 12 of which were randomly recruited residents and 12 people who were involved in the GAVA somehow, who were working on the initiative. Once we interviewed everybody, we did transcribe the interviews, we scored the 5 dimensions and highlighted any themes that emerged. The purpose, of course, of the study was to see if what was happening on the ground aligned with what the community residents knew. I wanted to show this slide really fast, even though we're not really talking about any major results except the park results. But we saw improvement kind of over time. As you notice in that the fourth column, the total in 2012, the average score was 4.2, which translates to the pre-planning stage. And that stage basically says that some community members are aware of the issue and acknowledge that physical activity opportunities are a concern, as there's maybe not that many opportunities in the area. They have limited knowledge about the issue and efforts, and limited resources are identified. 4 years later, in 2016, that improved a whole stage. So as the coalition grew and the implementation team kept making changes in the community, our score of 5.4 now translates to the preparation stage. Now, instead of some community members, it's most community members have heard about local efforts, are working to secure resources, and have basic knowledge about the physical activity access. And well, that's important, right? People may have the skills to be physically active, but if they cannot get to a park, or if the park is of poor quality, or PA program is not affordable or accessible, they will not be working out. Next, a few assessments were conducted in the community, one of which were gardens. We created a 6-item objective assessment looking at the quality and physical description of the school and the community gardens. We held interviews with garden coordinators on things such as programs and events being held, promotion of events, any classrooms that were involved in the school gardens, community involvement, maintenance, amount of plots in the beds. The baseline year for the school gardens was in 2015. All 5 gardens assessed at baseline are currently being assessed. And so while we don't yet have the results for the second round of assessment, in the baseline year, we saw that all gardens engaged several different grade levels and all focused on student education. 3 gardens had goals of greater community involvement, hosting more events, and building more beds. No garden produce was used in any of the school meals. Next, I'll talk about the corner stores. So to further get a better understanding of resources and ways people obtain food in the community, we turned to corner stores. In the baseline year of 2013, 5 stores were assessed, and like you see in this picture, we saw quite a lot of beer and sodas. 0 stores carried fresh vegetables. However, some did have canned vegetables. Amount of sodium is now a different topic. But 2 stores had fresh fruit, which were limes mostly, and 4 sold canned fruit. Whole grain items were very hard to come by, and no stores had eggs. The tool for looking at the interior and exterior environment, the built environment, and the healthy food inventory was modified NEM's Corner Store Survey, and there is a source on here, so you can take a look at that. As mentioned earlier, GAVA initiative is constantly evolving and assets keep getting added. which means the evaluation plans constantly get updated. So it makes it a very fun project to be on. Because of GAVA beginning the Healthy Corner Store initiative in 2015, us, the evaluation team, that year assessed additional 5 corner stores. And as a result of the Healthy Corner Store initiative, we have now seen fresh produce and healthy food items being stocked. And here is evidence of that. More things than limes. You can see some onions and oranges and bananas, and hurrah for that. All right, on to the parks. Lastly, using a modified recreation facility evaluation tool. So yes, we like to modify things a bit over here to suit our needs. We evaluated parks and playgrounds, sport fields, aquatic facilities, and recreation centers for safety, condition, and maintenance. 5 parks were assessed baseline year and 1 additional park in 2015. In 2013, only 1 park had an accessible restroom facility, 3 had water fountains, and 1 quote-unquote park had nothing. There was not a bench, there was not a trail, there was not a playground, it was just open space. These 2 pictures are from the baseline year, and you can see that some improvement is needed, which is what we gathered from all those, and that's exactly what the people said when we talked to them in our interviews. So along with the physical assessment of parks in the rec center, the evaluation team also counted the number of people in the park during various times of days. So we shall see if the number of people using parks has increased now from the baseline, which is currently up. We're doing that right now. Now, before you hear from Christine, I do want to show just a couple of photos of one particular park in Dove Springs, the before the GAVA initiative and the after GAVA initiative got involved. You will see the difference in the imagery will make it kind of very obvious about why the park results as what they are, and it'll make her section come to life a little bit more. So here is the before picture of a playground in the Dove Springs District Park, and here's one picture of the after. So it's a very, very, for the lack of a better word, a cool playground for kids. And there's also something for the adults, this little weight stations and training. And if I was smart enough, I would have included a zip line. And that is, I think, the only park that I've ever seen that has a zip line, which is very, very fun. And on to Christine.
All right, thank you, Aida. Well, I'm really excited to be talking to you about some of these results. As you can tell, as you've heard, there's a whole lot of effort that's gone into both the intervention itself and the evaluation. The innovation that is just part and parcel of GAVA requires innovation in the evaluation team as well, which is why there's so many different studies and lots of data to be looked at. But of course, we only have so many minutes on the webinar, so we're going to focus on just PA and parks, and share with you some of the movement we've seen in these data over the years. So the first thing I'd like to do is share with you this slide here that looks at children's PA and parks usage. As you've heard, GAVA is working to intervene and to improve PA facilities generally and parks in particular. Some of those photos that you just were able to see really show that there have been significant improvements in those facilities. And the reason that's so important is because we see an association between children's physical activity and the frequency of park usage. So this data that we're looking at here is baseline data. It comes from year 1. And the reason it's important is because it shows that relationship. So on the vertical axis, you have days of moderate physical activity, and on the horizontal, the frequency of use of parks and playgrounds. And you can see the positive relationship that we find between that usage and PA levels. And of course, that's important for general health for kids. So the evaluation is focused not just on detecting this sort of association, which is important, but also in looking at trends in PA usage over time. So we can start to understand which factors in the environment are important for increasing physical activity in the community. So these are also important because they're things that can be modified by GAVA. And we're going to take a bit of a closer look at issues around safety, programming like soccer teams and other activities, organized activities that are available in these PA facilities, and then the quality of the facilities themselves. Okay. So this graph shows an interesting relationship between perceptions of safety at baseline and how many people reported certain levels of frequency of physical activity. So the categories were frequently, sometimes, occasionally, and almost never that they were engaging in physical activity. And we're relating this here to the perception of safety for children to walk or bike to school. So the purple bar is, of course, what we want to see more of, that frequent category of physical activity. And I don't think this will be surprising to anybody, but the more safe people felt that their environments were, the more physical activity they were able to get. So, and for children, of course, in particular, that's an issue. Okay, so here again, another baseline look at safe and high quality playgrounds. As we saw earlier, we do know that the usage of playgrounds is associated with higher levels of PA in kids. I'm sure we probably all have memories ourselves of going to the playground and getting scraped up sometimes as a kid, but having a good time nonetheless. The quality and safety of those playgrounds are also important. And again, if you're looking at that purple bar of frequent usage, we see that among those who answered yes, that the playgrounds are good, quality, and safe at baseline, we have much higher frequency of usage. Looking at availability of free and high quality children's programming. So this would be, the soccer league, the basketball league, more organized offerings at the facilities. We see a similar relationship between good quality, free or low cost programs and higher rates of people reporting physical activity frequency in that frequently level. So these relationships are important because they give us an indication of where we can intervene, where we can make improvements that would possibly make a difference in the outcomes in terms of physical activity. All right, so now we're switching over to trends analysis, or looking at these same issues over time. And that is something we're able to do thanks to the tireless efforts of the data collectors. These folks have really, as Ada was mentioning before, knocked on a lot of doors, carried a lot of equipment, measured a lot of people. And so this is some of what we've found as a consequence of collecting all that data. This data is from our door-to-door collection, so knocking on doors here and looking at the larger community. And what we found is over the 4 years that we've collected data, that the percent reporting that PA programs are poor or fair has decreased. So even though that looks like a bad thing, that decrease is a good thing. We want to see that happening. And this is a significant relationship with a p-value of well below 0.05. Similarly, if we're looking at the percent that are reporting that the condition of physical activities are poor or fair, we see again a general trend, not quite as linear as what we saw with physical activity programmings, but still a significant trend in the right direction, which is downwards. So good news here is that we're starting to see some of the changes that we're hoping for. So this is a great example in real life of what's happening on the ground. So this play structure is from Ponciana Park. And at the beginning of our data collection, this was one of the parks that we assessed. And it was, I think Aida mentioned it, there was nothing there. There were no benches, there were no swings, there was nothing but kind of an oddly shaped plot of somewhat overgrown grass. And as you can see, just in the last couple of years, this really awesome playground has been installed and is there now for the community to use, which is a much better utilization of that space within the neighborhood. So here we see, again, some changes that are really positive. Now this is from the cohort data. So that refers to when Aida was talking about the dyads of parent and child, where we track these kids from kindergarten to 4th grade and their parents, which in and of itself is quite an adventure and kind of amazing to see the kids grow. But these are data over all 5 years of that cohort study, looking at the percent of those folks that are reporting that PA facilities are not safe. And we have a trend that we're happy to see generally, which is that fewer people are saying that they're not safe. So kind of a double negative, but it is a significant relationship again, and it is in the direction that we are hoping to see, which is fewer people feeling that there are issues with safety. Similarly, again, from the cohort, we're looking here at trends in the percent of people reporting that facilities are not of good quality. So again, some of the photos that were shared earlier, you can see for yourself that there are improvements and additions being made to the facilities in the area. It's very gratifying to see that reflected in the data. So again, year 1 through year 5, it's not exactly linear. And in truth, that's an interesting bit of information as well, to see if differences in programming and implementation are reflected in the data. That gives us not just the ability to circle back to the implementation team and let them know what's going on, which is important, but it also reassures us that the data that we're collecting, the results that we're seeing, are correct. So I don't know if I mentioned the p-value here below 0.05. So that's all good news. One more good news here. Again, with the cohort, so 5 years of data, the percent reporting that distance, safety, and quality are issues with the PA facilities in the 4.4 area code show a nice downward trend. So good job, all those sector teams doing their work out in the community. You can see it here in this simple graph. So what does that mean? And are we seeing real behavior changes? Can we detect those? These are all separate questions, in fact. And as Aida mentioned, one of the ways we're trying to track that is by going out and doing park counts. So we have a regular schedule of teams that go out to the various parks to see how many people are out there on any given day. We always make sure to go during weekdays and weekends because those patterns of usage are quite different. I think we all know that from our own day-to-day lives, that we have a lot more time on the weekends than on the weekdays. And we've chosen to focus on the Dove Springs Rec Center with this graph, mainly because we have the most data. So we have the most confidence in these numbers. And interesting, we see that throughout all the years that the Dove Springs Rec Center sees a little more traffic on weekdays than on weekends. But we see the same encouraging and positive trend in both those measurements. So as you can see, weekdays and weekends are both trending upwards over time. And of course, we're pretty excited about that. That's good news. So here we have a few photos of the Dove Springs Rec Center. You see that fabulous new playground up on the top left there again, and some of the activities that we are tracking there on the right. You've got a basketball game going on in the gym. So Dove Springs, I think by a lot of measures, is definitely a center of the community and is really fulfilling its mission in terms of providing those opportunities for physical activity and other issues as well. But we're focusing on PA today, so we'll stick with that. So the outcome that we're looking for is the increase in physical activity. So I have two ways of showing the outcomes here. This one is a little bit complicated, but I hope it's clear after we talk about it here. But we're looking here at trends in children's physical activity and parks usage. So kind of similar to that very first slide that we looked at, but it's over time. And we're seeing this then over the 5 years of the cohort. So this is aggregate data over the 5 years of the cohort. And we see across the bottom, we have the different categories of frequency of parks usage, and then the average number of days that the child is getting 30 minutes of physical activity. And so you see a very logical connection or association between physical activity and frequency of parks usage, even across that larger data set and that larger time period. So that's good. And then we see here too, just straight, very simple measure of utilization outcomes for parks, that we do have an upward trend, not exactly linear, but there's a lot of factors and variables and people working on this huge project, and the outcome is positive. So that's all good news. All right, so just to recap, we know that usage of parks is correlated with physical activity for children in 78744. We also have found that certain attributes of parks and other PA facilities have a relationship with higher PA frequency. And especially we found that perceived safety, perceived quality of the free or low-cost programming, and the quality and safety of the playgrounds were very important in influencing PA engagement. We also saw over time that following the implementation of GAVA, the trends in these perceptions of these attributes generally improved, and all of these improvements were significant. And then as a behavioral outcome, we were able to detect that community members in both the cohort and the door-to-door studies showed levels of PA increases over time. And that's really important because they are such different methods. They capture different populations. To see that the data agree generally is really powerful, and I think gives us a lot of confidence in saying that we are seeing real improvements in physical activity in the areas of the intervention. So, Aida?
Yeah. No, thank you, Christine. Definitely attempting to change the environment and behavior of an entire community is difficult and it takes time. But as you said, Christine, investing in physical activity resources and community leadership can bring about positive changes in physical activity in just as few as 3 to 4 years. So what's happening for the GAVA intervention? Well, they will continue to work on parks, particularly with some lighting or adding more green spaces, and especially drinking water fountains, because I think there are only 3 that had water fountains in the baseline year. They'll increase, try to get some increases in programs in the parks. They'll work on school parks and other physical activity facilities that can be used during non-school hours. And we'll continue working with community members to engage with city leadership so they can fund desired projects. Once again, any questions that are related to the initiative and the GAVA Coalition, please do not hesitate to contact the Executive Director of the GAVA Intervention, whose name once again is Carmen Yanis Pulido at carmen@marathonkids.org. Now, as for us, the evaluators, we can only capture a small part of the changes and improvement that are constantly occurring in the community. But by focusing on these non-traditional outcomes that we have been, such as the utilization and the perceptions and awareness and indicators of change, we have been able to identify progress towards GAVA's objectives. And just so you know who all spoke, here we are. Here are our emails, and you can send us an email whenever you want. Now we will take some questions right now. One of the questions was childhood centers with vegetable gardens, that the produce was not being used for lunches. What other outcomes are being measured for this intervention? As in, hopefully I'm getting this question right, but it seems that, so what are they doing with the produce? Well, so the main thing that we're measuring is, so we want to know what the purpose of the school and community gardens are. The school gardens, people want the kids to understand where the vegetables come from, the importance of it, the seasonality of it, and we also want to see if by being involved in the school garden, are kids now eating these vegetables, and has that behavior been changed in the home level?
The instrument that we use looks at a combination of quantitative and qualitative measures. So we're looking at the number of beds and how much produce is being harvested. And then in some of the other studies, we're circling back to look at whether there's been an awareness of the garden and whether fruits and vegetable intake has changed as an outcome. So one thing to keep in mind is that most of these gardens are relatively small, and they're really not able to produce enough to feed a whole school. So the real focus is on getting kids exposed rather than supplying the lunch program. So I hope that answered that question. Ada, you want to take another one?
So actually, I'm reading right now, this is Nika, Richard, your question, which is asking which entity paid for park renovation and park startup and maintenance. And just to clarify, with this being a coalition and resident-led intervention, although we have initial funding as support, this is the funding that's provided is mostly for staff. And I'm not completely fully aware of like where all the funding is dispersed, and it would probably be best to contact directly Carmen about what funding resources they all had. But from what we are familiar with, there is a lot of residents themselves talking to City of Austin officials, and they have a lot of testimonies of what changes they do want to see. And based on those testimonies, they have direct contact with officials to provide the funding for the projects that they seek to see improvement in.
Awesome. Okay, let's take another question.
In the beginning of the presentation, we mentioned the importance of making continuous changes. So what changes have been made to the program model based on the preliminary results of the evaluation? So it seems that what has the intervention team done with our evaluation results?
So I do think there's like an ongoing conversation going on where we do have what are called 360 meetings, where we'll meet with the evaluation team, we'll meet with the intervention team. So we will give them ongoing slices of what our data is looking like, which we hope is being actively used in terms of seeing what sort of work they want to put their efforts towards. This can also include another component of the work, which isn't noted here in the slides, but process outcomes as well as the more direct utilization and access outcomes that we look at here at UT Health.
Awesome. There's a question here. Did you think about getting churches or religious leaders involved in GAVA? I think I can give you a short answer, but for a long answer, you'd probably have to talk to the implementation folks. And I think the short answer is yes. But I assume you'd probably like a lot more detail about how that worked, and that I don't think we're qualified to answer that one. So, but it's a really good question. I think it's important if you're looking at a whole community-based effort.
To piggyback off of Christine, I have noted in their process the data that they do work with different institutions such as Austin Interfaith here in Austin. So that's one of the partnering organizations that's assisted with the work, as well as just to note, when it comes to terms of who's involved in the coalition, these stakeholders aren't just who live in the zip code, but also who work, play, and also worship in the zip code as well. So you do see pastors in our coalition.
Indeed.
Yeah. I see a question about cohort and how we got such a great retention. It's actually really kind of due to the fact that we were relentlessly, stalking people. At the beginning of the year, we actually made appointments at the rec centers and libraries for the fall data collection. And then come May, we would contact all the students who were in the study with a letter with all these dates that we scheduled in the fall. Come fall, right before the school year, we would call the parents, letting them know about various data times that we would have the height and weight measurements and the surveys. And we tried to be very flexible. We made appointments in the evenings on weekdays, before school, at the school where the kids were, after school, on weekends. We try to be as open as and flexible as much as possible. And I think even the last couple of years, we took advantage of the text messaging feature that we did not do the first couple of years, and that was really great. A lot of people responded to text messages quite quickly and easily, better than a phone call. We would talk to the parent support specialists of schools to get new numbers. A lot of our parents' phone numbers changed over time. I mean, even in a couple of months, they would change, or the phone numbers would be working in the beginning of the month and they would not be working end of the month. So we would just constantly call people. We would show up at schools just to try to get that number. A lot of the kids that we could not measure, they moved out of Austin to different states, out of the country, back to Mexico. But yeah, we were really happy with our 75-80% retention rate.
I also want to give a shout out to Aida for just persistence. That was a really important part. We've got another question here about, has the organization ever thought about partnering with the City of Austin and AISD? And I know Nika will be able to speak to that one.
Yeah, so I was just going to say, it's been really interesting. I work more so with the process data, and we do collect entity information so that we can do these really interesting network analyses. And first off, to note, we do partner already with City of Austin and AISD, and also, as mentioned in my introduction slides, we have over 122 different organizations within the City of Austin area that we've been working with, and that list has been growing. So it is really interesting in looking at these place-based initiatives and seeing how many partners attribute to the work and the impacts that we were seeing in our data and what implications that has.
All right, so is there any...
I think there's something about a community climate and how do we define
Yeah.
community climate. So I think that's probably from the community readiness interviews. And one of the dimensions that we scored, we looked at community climate with questions such as, how much is this a priority of addressing to the community members? Are community members involved, and do they show their support in doing things in the community when it comes to physical activity and nutrition? What else? I think I would need to look better at my questions now. I cannot think of them off of my head. I don't know if you guys remember Christine and Nika, because I know you were also involved in addressing this.
So community climate has a lot of aspects to it. One of them is going to be the readiness of people to address the issue. Another is the existence of funding and places to get funding.
Yeah, we basically just want to see what is the community's attitude when it comes to the work that the GAVA is doing on these two issues that we've been measuring over the past few years.
All right. So I think we have one more question. This one here. After how many years is your plan to expand and bring more exposure to the city of Austin and the surrounding areas about your mission and vision?
Well, I think that's what the evaluation does. So we want to see, is this intervention, first, is it working? Like, are we seeing any improvement when it comes to people's behaviors and their attitudes, when it comes to physical activity and healthy eating? The next question would be, is this generalizable to the other populations? Will this work in a community that is not mostly Hispanic, low income? Will it work in other areas of the country? We don't know. I think we would need to have maybe a little test pilot in a different part of Austin first and with a different population, and kind of try this same intervention again and see if it works. And then if it works in a few more areas, we can expand it to other neighborhoods, to other towns.
Well, I would say that the importance of GAVA, the innovation in GAVA, is that it's place-based. And so it's community-led and community originated. And so really the answer to that question, that's kind of a bit of a twist, is that it's not something that can be brought like wholesale into another place. It really is of the place. And so it's generated by the residents of the community in partnership with the city and with churches and with other organizations that work on these issues. So maybe the answer is a little bit of a different one, that it GAVA can come to your community anytime, but you gotta bring it.
We do have a question on park counts and do we go once a year? No. So we have a very specific protocol. For example, for Dove Springs Park, we go, we count the people who are using this park in March, 3 times in March. So in the morning, weekday, afternoon, weekday, and the weekend. And then we go back in August and November, so a total of 9 counts. And every year we try to go roughly on this, like basically the same day. So if we went on a Wednesday in 2016, on the 22nd, we will go on a Wednesday, the 23rd, the following year. And we'll go roughly on the same time. So 10 a.m., 10 a.m., 10:15 a.m. So not to bias it too much. And we also do note if there are any special events happening at the park. So if there's a birthday party, maybe that would increase the park count for some reason.
And Aida, I don't know if you want to also share just like observing weather conditions and how interesting that's been for our evaluation team when doing these parks
in Texas and with climate change, which is a whole other topic. We are in November and sitting roughly at 80 degrees. So when it's raining, obviously we're not going to go when it's, we try to go when we think people are at these parks. And the same thing with door-to-door. When it's raining, we can't really go knocking on people's doors. So sometimes our evaluation has to be kind of expanded in our time frame. And we have to be very, very flexible when it comes to things that are not in our control. Once again, I think we're almost out of time. We're 1 minute up. So please, please, please email us if you have any questions. Thank you very much for sitting in today with us. We really appreciate your time, and we appreciate being given an opportunity to share our results and the GAVA evaluation studies with all of you today. Thank you so much.
Thank
Have a great day.
you.
Bye-bye.